President Trump's proposed three-phase plan to reopen the country has received some really mixed reviews. You may remember that the president introduced those guidelines last week. And at that point, they were for state and local officials there, and economies were trying to figure out how to reopen. But governors do not need to abide by them. Connor Boyle writes that Mr. Trump's plan is a good start, but that it lacks essential guidance on several key issues. Connor joins me now from Philadelphia. He's a researcher in the Department of Medical Ethics and Health Policy at the University of Pennsylvania. So, Connor, you and your authors note that there are parts of President Trump's three-phase plan that you actually agree with. What do you agree on?
Absolutely. So thanks so much for having me, first of all. We agree with a few different things in the plan. First is the use of phases. So Trump's rhetoric for a while was open by Easter. It's going to be hard deadlines where we see all of a sudden a return to normalcy. And I think that the way the guidelines kind of spell out phases without very strict kind of timing attached to them is helpful. People need to realize that it's going to be a staggered return to normalcy that's not necessarily tied to a number of weeks or a number of months. It's going to take time, and we're going to need to look at signals in the data. The second thing we really liked in the guidelines was that there aren't really an equal risk of businesses. The guidelines recognize that a gym and a bar and a senior living facility are not the same in terms of the risk for explosive growth.
You know, one of the biggest problems that you write that you see in your plan is testing. We know that that is a big concern for so many people. The governor of California talking about it, New York talking about it. Where do you believe the president went wrong in testing, and is there a way to fix this?
A great question. I think that the guidelines are a failure from end to end in terms of testing. There is not enough testing, I guess, mandated. The testing that the guidelines are relying upon to justify reopening. It's hard to tell when there aren't enough tests if the trends that we're seeing over a 14-day period are robust, are statistically significant. And I think that if you look at countries that have tested more robustly, like South Korea, where again their ultimate pandemic kind of the situation they were dealing with is not as bad as it has gotten in the United States, but we propose a metric of 20 new cases per million residents as kind of a threshold for what would be safe to reopen. South Korea has been there since the beginning of April. As of Monday, there were 5 states that were only within 100 cases per million residents. So we're not really close to what we think is a safe threshold to be reopening any of these venues.
You know, it's interesting, Connor, I'm looking sort of at phase 1 of the plan, and it allows for certain large venues to open: movie theaters, sporting events, places of worship, restaurants. Does that seem like an awful lot of large gatherings for the first initial phase?
Yes. Aside from testing, I think the biggest glaring concern that we had when reading the guidelines was the reopening of large venues. If you look at historical peer-reviewed evidence and recent anecdotal evidence, it does not make a lot of sense to reopen large venues in the first phase or maybe even the second phase. They are petri dishes for exponential growth of virus infection. There was a specific example in Italy of a soccer match between an Italian and a Spanish side. 40,000 people about attended it. It was the middle of February, and it's now being pointed to as a catalyst in the exponential growth of cases and deaths in the Lombardy region specifically. So the fear is that if we are returning to large sporting events, how does distancing work? The guidelines are very vague in terms of what strict, moderate, lenient distancing looks like. We have a 6-foot idea that's been kind of floating around, but there's not a lot of certainty about what distancing guidelines would be if we were to reopen large sporting events.
You also make an interesting point, Connor, that you've got to go beyond and broaden this to also the asymptomatic people. You know, just getting tests for people who have potentially the symptoms has been hard enough. How do you broaden this, and why do you feel it's so important to also focus on the asymptomatic?
It's an excellent question. I think that, as we wrote in the article, asymptomatic testing is a focus that has not been at all the case in the United States so far. Asymptomatic testing is essential because people that are asymptomatic can still be super spreaders, quote unquote, can be kind of these vectors that are, if you're working in a supermarket, if you're interacting with a lot of people on a daily basis, the risk for you to transmit the virus to a large number of people is substantial. And even if you're not, you don't have a fever, you don't have a cough, there's still a very good chance that you could be spreading the virus. And so we've been focusing on the symptomatic, but as testing capacity increases, and it's somewhat plateaued, but as it hopefully increases, we think there needs to be frequent and recurrent testing of asymptomatic essential workers.
Frequent testing, that's something I keep hearing over and over on the show every day. I want to thank you very much.